Good evening. I'm Dr. Stephen Grobmeyer from Cleveland Clinic, Abu Dhabi, in the Oncology Institute and the Breast Health Center at Cleveland Clinic, Abu Dhabi. I'm very delighted to be with you tonight and appreciate the collaboration with the Abu Dhabi Public Health Center for this event to raise awareness about breast cancer. Breast cancer is important every month. But October in particular is a time when we focus on particularly raising awareness for breast cancer and some of the new developments and things that we can do to improve outcomes for patients with breast cancer. It's a time of education and a time to empower people to really take control of this disease. I'm going to cover a number of topics tonight, which hopefully you'll find very informative and will empower you and your family and friends to have a better understanding of breast cancer and what we can do to prevent it and treat it. So I want to begin by letting you know that breast cancer is an important public health issue. It is the most common cancer among women around the world. It's the most common cancer among women in the UAE. In the UAE, each year our data suggests that there are approximately 1,200 new cases of breast cancer diagnosed each year. It's a major public health problem. Breast cancer is like all cancers. Breast cancer is cancer that begins in the breast. Cancer refers to a process whereby a normal cell transforms and becomes a cancer cell and develops the hallmarks of cancer. That would be cells that grow too fast and cells that have the ability to spread to other parts of the body and compromise a patient's health. So breast cancer is cancer that begins in the breast, just like lung cancer is cancer that begins in the lung. The causes of breast cancer are really unknown. There are many things that we know are associated with a higher risk of getting breast cancer, which we will talk about. A minority of breast cancer cases are related to genes that patients inherit from their parents. Genetic mutations, such as mutations in the breast cancer genes, BRCA1, BRCA2, and many other genes now we know about, account for about 5 to 10% of breast cancer cases. Genetic testing is becoming something that is becoming more important in our diagnosis and management of breast cancer. Patients who in particular have a strong family history of breast cancer or who are diagnosed with breast cancer at a very early age, we know are at increased risk for having a genetic mutation. And this can change the way we treat breast cancer and other things we can do to improve the health of patients who are identified to have these mutations. In some cases, it's very helpful to know the family history so that we can make a diagnosis of a genetic mutation before a patient develops breast cancer. In these cases, there are many things that we can do to help patients to allow us to detect cancer if it is to develop at the earliest stages. And in many cases, there are things we can do to actually prevent breast cancer from developing in people who inherit a high risk for developing breast cancer. There are many types of breast cancer, and the main way we categorize the different types of breast cancer are by receptors, which we characterize on the breast cancer cells once a diagnosis has been made. The three receptors we commonly look for on breast cancers are estrogen receptor, progesterone receptor, and HER2. Each of those receptors characterize a particular breast cancer, and they provide a lot of information about how we might best treat a patient who is diagnosed with breast cancer. So aside from the different types of breast cancer, a question we often get asked is about staging breast cancer and grading breast cancer. Those are a little bit different concepts, and I'll try to explain them to you. Stage primarily refers to the size of the tumor and its location, whether it has spread from the breast to the common site, which is the lymph nodes under the arm, or to other sites in the body. Those are the main determinants of the stage of a breast cancer. More recently, in certain types of breast cancer, we're also doing genomic analysis of tumors. We're analyzing the genes within the tumor to determine what stage a cancer is. This is a newer concept and something that your treating physicians will help you understand better if the situation arises. Grade is different. Grade refers to how aggressive cells look under the microscope to the pathologist who's helping make your diagnosis. So we have type, stage, and grade, and all three of those are very important factors when your doctor and your treatment team helps outline a treatment plan for a given patient with breast cancer. They're very important concepts. When it comes to breast cancer, the most common symptoms that occur in patients who are diagnosed with breast cancer are a lump or mass in the breast that's new discharge from the breast, or skin changes, for instance, flaking or scaling of the nipple-areolar complex, or new redness in the skin. All of these can be signs of a new diagnosis of breast cancer. It's why we spend so much time emphasizing in forums like this and to our patients the importance of breast health awareness, or for some patients, it's breast self-exam. The important concept here is that in a common disease like breast cancer, when patients note changes in the breast, like those I described, they really should seek the attention of their physicians so that a workup and an evaluation can be conducted. This should be done in a timely fashion because in the minority of cases in which these changes turn out to be breast cancer, the sooner we make the diagnosis, the easier the treatment, and the better the long-term prognosis. So it's very important for patients who have those symptoms, lump or mass in the breast, new discharge, or skin changes, or any other changes that you think are new, should present to a doctor and have those symptoms evaluated. What will that evaluation look like? In most cases, you would report to a breast center, like the breast center at Cleveland Clinic Abu Dhabi, where arrangements will be made for you to be evaluated by a team of experts, including a radiologist and a trained breast specialist, who will take a thorough history, do a physical examination, and in most cases, order imaging studies that will be conducted in consult with an expert in the area of breast radiology. The doctors then, working together, will evaluate the history, the physical exam, and the imaging all together and make recommendations about what the next steps might be. In some cases, we're able to determine that there really is no suspicious findings and patients can return to their normal screening exams. In other cases, we will recommend that patients have a needle biopsy. And I want to spend a little bit of time talking about this needle biopsy because it's something we get a lot of questions about. In the old days, when a woman had a lump or mass in the breast, this is 25 or 30 years ago, it was extremely common for patients to be taken straight to the operating room for a surgical procedure with a scar to remove an abnormal area. Well, starting about 25 years ago, we developed technology that allowed us to do this in a much safer, better, and easier way for patients. And that was using imaging techniques to guide the sampling of an area with a needle. This is called an image-guided biopsy. We now know through lots of studies done over many years that this is a very safe procedure and can provide doctors with very accurate information that can allow them to treat you in the best way. We have no evidence that needle biopsies, which are safe, easily performed, easy to recover from, and involve no scarring, cause any detrimental effects whatsoever. In fact, needle biopsies can limit the number of operations needed for patients who are ultimately diagnosed with breast cancer. It can also allow us to more rapidly determine what type of breast cancer a patient may have and more quickly get them on to the proper treatment, be that either surgery or medical treatment, depending on the situation. So I want to emphasize, get symptoms checked early, be aware, and needle biopsies are safe and regarded as a gold standard for the evaluation of suspicious findings, either on physical exam or on imaging studies. I want to spend a little bit of time talking about breast cancer screening. Breast cancer screening refers to the performance of a screening mammogram, a picture of the breast, an x-ray of the breast. We recommend that this be done in asymptomatic women beginning at age 40 for patients who do not have a strong family history or other identifiable risk factors. Patients should get this imaging study done every 1 to 2 years beginning at age 40. The purpose of those exams is that we know from large studies done around the world that doing screening mammography can allow us to detect breast cancer well before any of the symptoms I mentioned before can be detected. It can allow us to detect cancers at a very small stage, make treatments very more tolerable and have a lot less side effects, and lead to much better outcomes for patients who are ultimately diagnosed with breast cancer. So we believe firmly in the importance of screening exams, that is getting regular imaging in asymptomatic women over the age of 40. We generally recommend this be done every 1 to 2 years, and that is a discussion that you should have with your doctor about the optimal frequency for your screening exams based on your personal and your family history. There are situations where we recommend that screening begin before the age of 40, and those are primarily in patients who have early onset breast cancer in their family. So, if a woman has a mother and a sister who were both diagnosed with breast cancer at an early age, then we would recommend, in addition to that patient considering and the family considering genetic testing, that this is a person who might benefit from starting screening at an earlier age, with the belief that if there's early onset breast cancer in other family members, that this trend may also occur in the index patient to whom I'm referring. So this is something that patients should discuss with their doctors and come up with a plan about the best program of screening for an individual patient to optimize outcomes. Some patients also who are particularly high risk, and we have models to actually predict breast cancer risk among a given patient, we actually recommend that more intensive screening be done, and those are generally women who have greater than a 20% lifetime risk of developing breast cancer. And those women will often use magnetic resonance imaging or breast MRI in addition to mammographic screening, with the idea that these are patients with higher risk breast cancer and will take extra steps to try to identify cancer at its earliest stages in these patients. Another common question that we receive is, what can I do, what can I personally do to reduce my risk of getting breast cancer or improve my outcome if I get breast cancer? So, what we tell patients is, and there's growing evidence that exercise on a regular basis, several times a week, even low or moderate intensity exercise, we now know is associated with a reduced risk of getting breast cancer, as well as weight management, keeping a normal body weight through diet and exercise. And we also now believe that a low-fat diet is a very important part of reducing one's risk for breast cancer. In general, one should strive for a diet less than 20% in fat. And we now know that this is associated with a lower risk of getting breast cancer and a better outcome for patients who ultimately develop breast cancer. Other things that patients can specifically do, as I've already mentioned, are to know your family history. And if you have a strong family history, in particular of breast or ovarian cancer, then this should be discussed with your doctor. And in many cases, this can also be discussed with a certified genetic counselor, such as we have at Cleveland Clinic Abu Dhabi. These are medical experts who have specific training in cancer genetics and can be very helpful in for patients and families deciding whether they would like to pursue the blood test called genetic testing. And the last thing I think people can do is to participate in screening and follow recommended guidelines, because we believe this is the safest way to detect breast cancer at the earliest stages. One of the very exciting things that's happening in the world of breast cancer is all the new treatments that we have to offer patients who are diagnosed with breast cancer. New treatments are offering greater hope than ever for many patients diagnosed with breast cancer. In patients who are diagnosed with breast cancer, we believe they're best cared for in a multidisciplinary setting. That is, going to a clinic where you have a group of experts in surgery and the medical treatment of breast cancer, and radiology, and genetics, and pathology. And a team like this can work together to provide recommendations about the best approach to treat breast cancer. The team would also include doctors with, in some cases it's needed, doctors with special expertise in breast reconstruction. So again, this team concept is very important. And when a patient comes in with a diagnosis of breast cancer, we first analyze what type of cancer it is. We then often will do studies to see how extensive it is or determine what the stage is. We'll then look at the type of breast cancer, and the team will work together. And we also work through a group called our Breast Cancer Tumor Board, where all of our experts come together and review a particular case. And then we make recommendations about what the best path of care might be for a given patient. And I can't emphasize enough the importance of analyzing each individual case separately. We don't treat all cases the same. It depends a lot on the type of breast cancer, the stage, the health problems of an individual patient, the patient's goals and desires about treatment, and what they would like. We certainly consider that in our decisions about how to treat patients. One of the first decisions we have to make regarding the treatment of a new diagnosis of breast cancer is whether we should do surgery first or we should start patients on medicine first and then do surgery. To treat breast cancer, we really have several modalities. We have surgery, we have radiation therapy, and we have medical therapy. And the medical therapy would consist of either hormone therapy or some type of chemo or targeted therapy, which are drugs like chemotherapy or targeted therapy that are medical drugs which target cancer cells throughout the whole body. So in every case, we have to decide, should we use medicine first, chemotherapy or targeted therapy, or in some cases hormone therapy first, or should we do surgery? The trend these days for many cases that we're seeing particularly here is that we use medicine first, and there are many reasons for that. And again, it depends on the type of case, the type of cancer, the age of the patient, and many other factors. But that's where your team of experts really comes in. If we do medical treatment first, that medicine lasts about 4 months. We wait then about a month, and then we do surgery. We bring a team of experts together to perform the surgery and reconstruction if it's necessary. In cases where surgery is done first, we complete the surgery. We then ask the question, does the patient in this particular situation need chemotherapy or targeted therapy? If they do, we give it. And then after that, we give radiation therapy if it's needed. So again, the order goes either surgery, chemotherapy if needed, then radiation therapy, or it goes medical treatment, chemotherapy, or then surgery and radiation if needed. And again, the team of experts can really help decide what the best combination for a given case may be. Another option we have these days is hormone therapy. So majority of breast cancers express a receptor for a female hormone called estrogen. And we've had for a long time, and we're constantly getting new medications that allow us to block estrogen and the estrogen pathways in different ways that are given to patients after the initial treatment is done. Patients will stay on these medications for 5 to 10 years. And we now know that these medications, sometimes combined with other medications, can be very helpful in improving outcome and reducing the chance that a cancer will come back. But I can't emphasize enough the importance of getting to a center where you have a group of experts who can work together to take care of you. Taking care of breast cancer is not best done by one individual, but by a team of people. I would also strongly encourage people in breast cancer, not only breast cancer, but other kinds of cancer, to seek second opinions, because often our best shot to treat cancer is the first shot. And so it's important that we have all of the details correct and that you're completely comfortable with a group of people taking care of you so that we can move forward and give patients the best hope for a long-term outcome. And then I would like to say that thank you for your attention for this presentation. Again, I would like to emphasize that the most important things that individuals can do relative to breast cancer is to be aware of many of the educational materials being provided tonight and in other forums during the month of October and other months. It's important that people share what they know with their friends and their family so that patients, for instance, get screened at the proper time so we can reduce the morbidity and side effects of treatment of breast cancer if it's going to be diagnosed. And I think finally, it is important that we all participate in public health recommendations, because all of us participating together, banding together to participate and educate, can really make a big difference in reducing the burden of breast cancer in the UAE and around the world. So I have a few questions which I will answer. Let me see here. Why is there more people have cancer? So one question is, can patients return to a normal life? I would assume it's being asked, can patients return to a normal life after breast cancer treatment? Absolutely. Majority of patients with early stage breast cancer in 2020 are cured. They need to be followed after their treatment, but majority of patients are cured, and we have very good treatments for breast cancer. And yes, patients can return to a normal life. There is a transition period, and one of the things we focus strongly on after treatment of breast cancer is with our rehab group. It's well recognized that the side effects of surgery and radiation, for instance, can cause issues in the area where the surgery is being performed, but a lot of this can be overcome by the use of aggressive interventions like physical therapy. Another way we can reduce the side effects of treatment is by education. Some patients who have breast cancer treatment are at risk to develop something called lymphedema in the arm, and that's a problem we've been facing for a long time. It's why we spend so much time trying to reduce the types of treatment that we have to provide to patients so we can limit the side effects. But in spite of that, some people are at risk to develop arm swelling. That's called lymphedema. And if a patient develops lymphedema, it can be quite problematic for some patients. But we also know that with early intervention, by referring patients to physical therapy, we can educate, and with early intervention, we can very often reduce the side effects or sequelae of lymphedema and prevent it from becoming a severely debilitating problem. And so again, it's an example of all the things we now have: better surgery, better recovery, more targeted treatments to provide patients with better outcomes and less side effects from treatment. We have another question, which is, what is the difference in the treatment between genetic cancer and non-genetic cancer? That's a very good question. So, as I mentioned before, patients who meet certain criteria, or patients who really are motivated to be tested, can have a blood test done to analyze whether they have one of the 12 or 14 genes which are associated with a higher risk of developing breast cancer. When we do that test and we identify patients who have one of these genetic mutations, there are special considerations that we often make. I will use, for an example, the BRCA1 and BRCA2 genes. These are the most commonly studied and the genes that we know most about. But in patients who have these genetic mutations, sometimes patients will elect a different surgical procedure because they know, because of their mutation, they're at significantly higher risk to get another breast cancer. So in many cases, they'll choose to have more surgery to reduce their future risk. In other cases, patients would not choose additional surgery, but they would choose to be followed much more carefully in the future. And we can do that, and we can offer that within a program like we have at Cleveland Clinic Abu Dhabi. It's also important to recognize two other things when it comes to genetics. With the breast cancer genes BRCA1 and BRCA2, We know patients are not only at risk to develop breast cancer, but they're also at risk to develop ovarian cancer. So at the appropriate time, we know that the ovaries can be removed electively through a surgical procedure, and that can significantly reduce the risk of a woman who has a genetic mutation developing ovarian cancer. We also now are learning that there are certain medications to treat breast cancer that may actually be more effective in patients who have BRCA1 or BRCA2 mutations. And so we're learning more and more and more, and I suspect in the future we'll continue to learn more about ways that we can specifically target cancers that have arisen in the background of a known genetic mutation. And then finally, the important part about genetics is that if a patient is diagnosed with a genetic mutation in breast cancer, that would mean that there's a 50% chance that their children also have that mutation. And that can be very empowering to families, and that when children reach an older age, that of a young adult, they can be tested also. And it can be determined when it's at the appropriate time for a given person and their family. We can determine if that patient has a genetic mutation. And as I mentioned before, there are many things that we can do to screen those patients much more intensely than we otherwise would. So there's a lot that can be done, and that information can be very empowering for the treatment of the cancer which the patient has come to see us for preventing other cancers, and can have a major impact on a patient's family. There's another question, which is, where are breast surgeons in the UAE? Which hospitals? I can comment, I don't know all hospitals in the UAE. I would encourage patients to seek experts, as I mentioned, teams of experts who have special training or interest in the treatment of breast cancer. We firmly believe that all cancer, in particular breast cancer, is best treated by a group of specialists. In many parts of the world, doctors can receive special training in the treatment and management and detection of patients with breast cancer. And major centers, like the one we have at Cleveland Clinic Abu Dhabi, has doctors working who have received that specialty training. And they come together, they work as a team to diagnose and treat patients. And as I mentioned before, another unique aspect of a fully functioning cancer program is a concept called Tumor Board, where all patients who we see are actually presented in a formal way to an entire group of doctors, where we can review cases together and make sure we're coming up with the best recommendations for patients given their particular situation. So I hope you found this session informative. It's an exciting time because there's so many exciting things going on in the realm of breast cancer, and so much that we can do and empower ourselves and our families to really reduce the burden of breast cancer. And I would encourage everyone to continue to educate themselves and to spread the word about the importance of screening and healthy lifestyle and everything that we can do to reduce the burden of breast cancer. So thank you and good night.